So I'm going to talk today about congenital heart disease. And I'm going to start off by dividing it into cyanotic and non-cyanotic. So if there's cyanosis, yes, no. So for the cyanotic diseases, I'm going to ask, is there a direct aortic pathophysiology? And yes and no. So the ones with direct aortic pathophysiology are tetralogy of Fallot, transposition of great arteries, and truncus arteriosus. The ones with no direct aortic pathophysiology are total anomalous pulmonary venous return and tricuspid atresia. As far as non-cyanotic diseases go, we're going to divide that based on also pathophysiology or mechanism. So if there's a septal defect, and yes, no. So if there is, we've got VSD, ASD, and endocardial cushion defect, which is kind of both ASD and VSD. And of course, if there's a septal defect, the main one is patent ductus arteriosus. So I have to discuss something called an Eisenmeiger's syndrome. And that's when all the congenital heart diseases that I described that are non-cyanotic become cyanotic. So these non-cyanotic congenital heart diseases that I described are all also called left to right shunts. What happens is, because the pulmonary vascular resistance drops in the first couple of weeks of life, more blood flows through the lungs. But what happens because of the blood flow is the pulmonary capillaries start to become non-compliant. And what do you know? The pulmonary vascular resistance starts to become elevated. And as a result, something that was a left to right shunt can either present simultaneously with a right to left shunt or completely become a right to left shunt. And that's a dilemma you run into especially with the VSD and the ASD. So that you've reached the end of my video. Thank you for watching. Please subscribe.